Afternoon. I'm pleased as your chair to welcome you to our May Lunch and Learn virtual event. Thank you for joining us for the next 60 minutes to hear a lively and informative discussion on how we can get back to meeting safely and ensuring the safety of our attendees and our participants. We have made it to May. 2021 continues to give us hope as we see more and more events coming back online. Convention centers and hotels opening back up, and more of our citizens getting vaccinated. I'm excited about the rest of the year. Your generosity and support of our two charities the past few months is very much appreciated. Today, I've invited Allison DeCourcy, President and CEO of United Communities, to say a few words about our support of this important local charity.
I hope that when we all get back together, we don't move back to just getting by, but getting along, so that we could take my community out of striving to thriving.
The greatest surprise has been how resilient people have been during the pandemic. They continued to make it work through the help of United Community and a vast group of partners and other nonprofits that we work with. Their trust in us, their will to keep fighting is just inspiring to me.
Ayudando a la comunidad en lo que podamos.
For 50 years, we have been serving our community and serving it well, but our community needs more from us because multi-generational poverty still exists. So we are going to rebuild in a way that puts community at the center of everything that we do. We want to and need to hear from the community what is it that they need that will lift them up.
It's not just about food, it's not just about shelter, but it's about bringing dignity to families in the midst of the pandemic.
Your board of directors has been hard at work this past year, despite not being able to meet in person. Mentoring our young professionals is an important initiative to continue growing the industry. At this time, here is a message from Austin Kappa, the Young Professionals Director on the board.
Hello, everyone. My name is Austin Kappa, and I'm the Director of Young Professionals for our IAE chapter. This year has been a particularly challenging year for our industry, and I understand how difficult it can be for our young professionals, those starting out a new career and those still navigating their path. With the changing landscapes of our industry, and with many of us still working from home, it is important now more than ever to get involved and carve out your place in the industry. I want you to know that I will be your champion in doing that. Last month, we launched a LinkedIn group specifically tailored for our YPs. There, we will share resources, provide updates on upcoming events, and more importantly, create a platform for you to connect with like-minded individuals. This can be a wonderful tool to engage with others in the industry and become more involved with areas you might be interested in. This group is IAE DC Chapter Young Professionals, and please feel free to email me or reach out to me for more information. In addition to that, one of our goals for our chapter is to develop a mentorship program between industry veterans and young professionals. We are currently putting together a framework for a kickoff event to connect mentees with mentors from the vast segments of our industry. I believe both groups can learn from each other, with veterans offering their invaluable experiences, while YPs can leverage their innate prowess in navigating the digital world. These are relationships that are intended to grow and develop over time, even after the event. If any YPs are interested in getting involved, or if there are industry veterans that are interested in offering some of their time for this effort, please reach out to me directly or other members of our board of directors. Finally, every quarter I attend a national YP committee meetup. This is a virtual session to provide an opportunity to listen and share with other YPs from across the country. I want your voices to be heard during these sessions. So please reach out to me and let's talk about some of your questions and some of your concerns. You can find me on LinkedIn or by emailing me at austin@bearanalytics.com. Thank you.
Please join me in thanking our sponsors, ASP, Clarity Experiences, CVent, EPNAC, MAR Association and Meeting Management, and MDG for their continued support of the chapter. I really encourage our suppliers to consider supporting the chapter events throughout the year. I also want to thank Clarity Experiences for their support in producing our virtual events the past few months. Here is Brian Legacy with a short message from Clarity.
Hi, I'm Brian with Clarity Experiences, a live event creative production company. We're here to help you today with some scenario planning and tools that you may need for your upcoming events this fall or next year. What we want to do is help you figure out the best scenario based upon the venues you're going to be and how you can manage your number of live attendees or your number of virtual attendees. We also will help you with the contract negotiations with the hotel and making sure you keep all the different elements in there that give you freedom of choice and give you the leverage you need to have a remarkable event. From a cost side, Clarity wants to make sure that you have an amazing price to value relationship. That means you have an awesome event and the price fits your budget and is reasonable for you and makes a lot of sense. What's great about Clarity is our pricing is similar across all the major markets in the US, so you can have a consistent plan for your overall budget, no matter where you're going to be in the United States. Over this past year, we have expanded the capabilities of our team. I'd love to talk with you about one of the elements that we can provide for you, which is our design to reality. We work with you on the overall vision for your event, and we build custom graphics and tools that allow you and all of your different attendees and presenters to see what that event will look like. Then we come together on your event and we make that design and that vision come from the reality of that event. I look forward to seeing you in one of the venues in the near future, and I hope you have a great day. Thanks so much.
And now it's time to turn the screen over to our distinguished panel to talk about participant safety during our live in-person events. An industry icon and ardent supporter of getting our industry back to live meetings, please join me in welcoming the president of AIM Meetings, Walt Galante, who is leading this discussion and moderating an engaging conversation on participant safety. Walt, the screen is yours.
Hi, everybody, and welcome to the May meeting for the IAEE chapter, DC chapter. I am privileged and honored to be called upon to be the moderator of this great panel of experts that are going to talk to us today and give great information to everyone in the audience about getting us back to live meetings safely. I've had the honor and privilege of working with all three of these individuals, and I'm very happy to bring them to you to share their experience. The first person on the list is Owen Poole. Owen is the COO of Inspire Health Alliance, which is headquartered out of California, but like all of us, Owen is currently living and working out of Tennessee. He has spent almost his entire career in the healthcare business and trying to bring manageable healthcare to people around the country. I got introduced to Owen through a mutual friend of mine, and have been working with Inspire regarding the rapid tests to bring to meetings, as well as the PCR tests. The next person on our panel is Shannon McCallum. Shannon actually works for Volan Technology. She is out of Las Vegas, Nevada, so we really have a cross North America panel of experts. Shannon has spent 30 years. She doesn't look it. She really is. It's wonderful. She spent 30 years in the hospitality business. Most recently, before joining Volan Technology, she was the vice president of operations for the Aria Resort and Mandalay Bay, and she's currently the chair of the Nevada Hotel and Lodging Association. Volan Technology is a company that's involved with contact tracing, and will speak about contact tracing in regards to the meetings and events area. Our final panelist is, for lack of a better term, the planner for planners. Angela Cox is the Senior Director of Meetings and Events, currently for North Star Media, the media conglomerate that owns a variety of magazines within the hospitality industry. And she has worked for associations. She has worked for large trade show companies, and she is the person that organizes the planner events, the hosted buyer events for North Star. And so in that regard, I have to tell you from personal experience, Angela's ability to deal with people like us is absolutely amazing. Her patience is way beyond most of us meeting planners. So that's our distinguished panel. Angela, actually, just to give you another explanation of how our panel is really throughout North America, Angela is currently residing in Cabo. And so therefore we have people literally from all over the country to bring this information to you. Without further ado, I'm going to turn this over to Owen Poole. And the way this is going to work is each person is going to take a few minutes to talk about their area of expertise. If you have any questions along the way, as you all know, please put them in the chat box and we'll try to get to as many as possible. I'm going to turn this now over to Owen Poole, who's really going to talk about testing prior to coming to an event, and then what may happen in terms of trying to get rapid testing on site. Owen, take it away.
Thank you, Walt, and thanks everybody at IAEE for allowing us to be here. I was thinking about this before we put together what we were going to show you, and I think after you get past the first responders and so on, probably the most difficult journey that anybody's faced is what this audience has had to undertake. So I commend you for getting us all back out where we can network together and create some real value for ourselves. I think it's been sorely missed for the last year and a half, and I applaud you and appreciate the opportunity to be here. The other thing I want to do is walk you through some of the confusion that has been out there regarding testing and the COVID impact in general. I think early on we didn't know enough about this infection, this virus, and then there was so many different media outlets and so many different places telling us conflicting or certainly confusing stories. My goal here is to demystify a lot about that and to make certain that you feel like an informed, leading, consumer so you can lead your conferences, your events in a direction that ensures a high degree of fun, trust, security, and a great experience. Without getting into too much detail, and I do understand that the slides will be available for you online. So if you look at this slide with me, there's really only 4 important concepts. If you start with the initial antibody line or the bell curve across this 14-day span, the brown line represents the initial antibodies. They show up when the body realizes there's enough of the infection present to begin to fight it, and it dissipates very quickly. The second one is the antibodies you hear everybody talk about in the news. That would be the green line, and you can see as the course of the infection dissipates, it starts to get higher and stronger over time. And that's the antibody associated with immunity, whether it's because your body defeated the disease or because you got an immunization. What we're here to talk about are the 2 bell curves in the middle under stage 2. If you look at the top bell curve, you'll see PCR. That is the molecular test, or the one that needs to go to a complex laboratory, and that's an official name, a high complexity lab. Generally speaking, you can go get those tests and send them off to the laboratory. There's a registration process that we'll talk about in a minute, and then the results come back to you, generally speaking, electronically. The antigen test or on-site test is what most people more informally call the rapid test. And that's administered and resulted on-site. Takes a little bit more room and planning, not a lot, but it will yield a result once the specimen is collected in about 10 minutes. And so what we're going to talk about is how to use both one, the other, or frankly both as a surveillance methodology to provide a safe, predictable, less disruptive environment that keeps everybody secure and happy. If we look at this test example real quickly, I think there's a couple of things we want to go over. The first thing is, if you think about those bell curves over that 14-day spread, the real issue is everybody's at 100% effectiveness if it's within the confines, read that stage 2, the confines of enough of the presence of the infection to be detected. We talked a lot about that early on, but now we know it's just a matter of how much more or sensitive the different tests can be on each side of the bell curve. The PCR test with the antigen test together means you're actually approaching, statistically you've achieved 100% efficacy or accuracy in detecting the disease before anyone enters. That means with the right planning, and we systematically approach it in our company, other companies do this as well, that you can get the PCR test sent to you as late as 3 days prior to the event, get it back to us, and have a result from a complex lab before you come to the registration desk at your event. It is important to remember that when you do that, we incorporate UPS. You've got to make sure you follow the timelines. And it's pretty easy to self-administer the initial test so that you can get it out and back for a result that comes to you. Everything is HIPAA compliant, and it feeds off a web access where you register, so that we're not having your attendees try and work with that once they arrive at your event. Once in a while, somebody may not get around to it, as they used to say when I was younger, and maybe they didn't get their test into the shipping on time. Maybe they forgot about it or what have you. But the antigen or rapid test provides another backstop or fail-safe that really works well. That particular test is about the same complexity very easy. It's a mid-nasal, very easy for an attendee to collect the specimen, provide it. Now you need a little bit of time for that specimen collection to be processed, a couple of minutes, and then the result is available in 10 minutes. One of the things that you need to remember when you're using the antigen test is a little bit about conference workflow. I know this group knows a lot more about conference workflow than I'm going to try and get into, but we do need to remember a couple of things that typically we've not had to work for before the world of COVID-19. As people present, you're going to need a way to not only manage that workflow, but understand where you're going to have them for at least the antigen test while they're awaiting their result, and some kind of protocol defined by you or your customers with regard to how we're going to communicate with someone, however unlikely, that may have a positive test. When that happens, you need to have a place and a plan for where they go, how you isolate them, and what you would ask them to do, whether it would be go back to their room, how you're going to retest in a certain period of time, as most do. But ultimately, if you have a positive test, we're trying to manage risk by isolation. And then finally, when you have a result, you begin to plan on how we're going to bring them into the conference and sustain that. We'll talk about that in a moment. So what that really means is, what's the self-awareness look for and look like as you begin to plan your options in the conference? I wanted to keep this pretty simple because the reality is we can make it as complex to talk about as we choose to, but this is in your hands and very manageable. You need to make sure you have a company that's done this before. You need to make sure the tests are approved by the Centers for Disease Control. They call that an EUA approval or emergency use authorization. Ours all do. And you need to make sure you're thinking about what kind of group you have and if they're going to be in a call to order for the event. Are they going to be excited about taking the test in advance? Or are we going to need to have a few more resources on site if you're doing all or depending largely on the antigen rapid test? And also there's some space and workflow considerations. Last but not least, we want to achieve or suggest you achieve, and we do in our world. I would suggest our competitors probably try and do the same thing. Make certain that so much of the workflow that we can possibly handle around just the testing becomes a non-disruptive experience, and that we are as attentive to making sure this is a positive experience and a safe experience for your attendees as we possibly can. Which brings us to delivering a cost and resource effective approach. Walt and Company have worked with us, and I'm sure you can find many alternatives to make sure that there's a couple of different ways to approach it that really is very favorable to minimal to no cost at all to out of pocket to your consumers and your attendees. And many different approaches are out there. It's a matter of how much infrastructure you're going to need and how you're going to set up your testing environment. And with that in mind, if we can move to the next slide, that just leaves us with, once everybody's gotten there and we've worked through the testing, where did everybody go? And Elmer Fudd's sending us to Shannon McCallum, who is an expert on testing and tracing, just as Walt alluded. Shannon?
Thank you, Owen, for that gracious introduction. As Walt mentioned, due to the length of my career in the hospitality industry, the safety of guests and employees is very important to me, as is the recovery of the travel industry. I feel very fortunate to be able to play a part in providing safety and analytics tools to assist with the recovery of meetings and events. Today, I will be sharing some slides to you as we discuss contact tracing. The question that you are all thinking about today is, how can we resume meetings safely? This past year, virtual meetings have played a role in allowing us to continue our business remotely during the pandemic. However, there simply is no replacement for in-person session engagement, networking, and for showcasing products. Building trust that gathering in person is safe is so important for the meetings and events industry. Meeting professionals all over the country and internationally are educating themselves on what tools are necessary to create a safe meeting. Some of these protocols may include creating a code of conduct for what expectations will be in place for the meeting, potentially wearing a mask and social distancing requirements, although as we've seen over the last 24 hours, things can change very quickly, potentially room capacities in different cities, states, or countries, doing temperature checks, or just like we just heard about PCR tests to attend a meeting. Also, elimination of touch points like exchanging collateral and business cards. And of course, adding tools such as contact tracing. Let's now talk about contact tracing and analytic solutions. First of all, why is contact tracing important? Although vaccinations are happening all over the country, not all attendees will be vaccinated for a variety of reasons. That may be medical, personal, or religious. Or potentially they may be at different stages of vaccination. Perhaps they have their first shot complete, but not their second. Or they're waiting for a booster shot like we will all be doing in the fall. There are also variants around the world that our vaccines may not be effective for. Now, I also know that even though I may be fully vaccinated, nothing is 100% effective. So if someone at your meeting gets sick during or after the gathering, digital contact tracing can be done across thousands of attendees in just minutes. It is critical to see who is most at risk so they can be contacted in a priority fashion. Having digital contact tracing solutions at your meeting provides the ability to anonymously capture interaction of attendees within your organized meeting space. Now, the CDC guidelines define contact tracing as the ability to capture proximity, frequency, and duration of the interactions. It is important that you look for a solution that adds up all of the interactions across the days of your meeting for a full picture of the potential exposure. On this slide, you can see an attendee wearing a Bluetooth device. When he or she enters into the meeting space, the device will appear on the geofences, and any dwell time with others will be captured as anonymous data with a 4-digit code. The meeting planner can then access the data in case someone becomes ill during or after the meeting. Now let's talk about how contact tracing works. Why is capturing attendee location important for contact tracing? Some contact tracing devices only detect proximity, but not the location of individuals. We now know that COVID is just not a person-to-person exposure virus. Particles can stay suspended in the air for 15 or more minutes, and a proximity-only device cannot capture this data. Location data also allows for the creation of a sanitization plan to further limit exposure to attendees or employees. And that's based on the last locations that the COVID positive individual was in the meeting space. Now let's look at what the meeting flow looks like when you incorporate contact tracing. It is critical for your meeting that you find a contact tracing partner that will do the heavy lifting for you. Look for an end-to-end solution. Meeting planners have enough to do, and learning a new technology and managing it is just simply too time-consuming. Find a partner that will provide informational material to you for your website, for your pre-arrival emails, and for your registration. Also, your partner should work with you on your preferred registration flow and the method of device distribution. They must coordinate with the property team to arrange the setup times as your meeting rooms are available and monitor the data during the event. In addition, they should take care of the devices and getting them returned and the removal of the equipment. You as a planner have so much to do already, so the solution you choose should be a seamless experience and allow you to focus on your meeting operation. Let's focus on privacy now. Privacy is critical. It is important that the solution you select keeps your attendee information secure and private. Your attendees may have concerns about wearing a positioning device, and keeping the technology focused on the organized meeting space will ease these concerns. By using a Bluetooth technology, there is no identifiable information on the devices. Unlike cell phones, any interaction outside of the organized meeting space remains private. Also, by communicating how the technology works in advance and during the registration process, we'll clearly outline where the technology is active and why it's important to wear for all organized functions. Now let's go back and review the benefits of contact tracing that we've talked about. At any time in the meeting, if an individual exhibits symptoms or tests positive for COVID, the planner can conduct a contact trace to determine attendees who were most exposed. The data provides a ranked list of exposure to avoid panicking all attendees with a mass communication. Instead, smaller groups of individuals can be contacted based on risk level with a tailored communication. Bluetooth devices can capture proximity, duration, and frequency in accordance to the CDC guidelines. They also can provide a sanitization path for the property to avoid further exposures. Now think of contact tracing as a tool in your tool belt to reduce risk at meetings and to show attendees that you're doing everything possible to keep them safe while they're in the organized meeting sessions. It is now my pleasure to hand over to Angela Cox with North Star Travel Media, who I have had the pleasure of working with on several meetings over the past few months. She is truly the expert on how to put all the safety pieces together for a successful and safe in-person gathering.
Hi, everyone. Thanks for having me, Walt. And Shannon and I look forward to seeing you on Monday at our next event over in Miami. I was trying to organize my thoughts about how to come up with a plan, and I came up with a little, I forget what you call it, but three words that would bring CPR back to the meetings industry. And my talking points are going to revolve around communication, partnering and staffing, and having rules set in place, which are basically going to be your plan. So the first step that you need to consider is, what's your company's or association or group's safety policy going to be? Are you going to require people to get a test? Are you going to require them to wear a mask? Are you going to allow them to hug and embrace? Or what's your social distancing plan going to be? When you're coming up with your plan, you need to make sure that you compare your plan with that of the venue or venues that you're going to be using, as well as the location where you're going to be. Sometimes the location where you're going to be may have more relaxed standards than what you're wanting to do. For instance, our first live event in 2021 was in Arizona, and right before our event, they relaxed their standards. And but luckily, our hotel was still having the same plan as we wanted to, which was 6 foot social distancing, masks required, lots of hand sanitizing stations. And then in Miami, where our event is on Monday, Florida's wide open right now, but the hotel again still has similar standards to what we do, except for outdoor spaces. So we've asked their staff to follow our standards during our event in outdoor spaces. And then back to the C of CPR, you've got to figure out how you're going to communicate this plan and how often you're going to communicate it to your attendees. More on that in a little bit. Next, you need to define your group that you're going to require to follow these safety policies. The easy part is your attendees and your staff, but what about the hotel staff? What's the hotel's policy, and will that be enough for you? Or do you want them to, take additional measures? Do you want them to wear the geo trackers? How about your speakers? How about your vendors, decorator, audiovisual people, your entertainment. In my world, in my thinking, anybody that's going to come into contact with my attendees, I want to know that they're safe before they get in contact with my attendees. So for North Star, we're presently requiring proof of negative test or proof of vaccination. And for the testing, we used Inspire Diagnostic as one angle or one avenue for people to get the test, and it was up to the individual to figure out how they wanted to get tested or or provide proof of vaccination. And providing proof of vaccination or the negative test is something that you need to consider and talk to your HR department and possibly legal department, because it is health data. And how are you going to keep your attendees' health data secure? It's not as simple as, hey, let me email the planner or even email a designated staff person. You may need to come up with a safe and secure solution. We used a company called Safe Access to capture this information, as well as capture compliance to our liability waiver and our rules for the event. So getting a secure method for this data storage is key for you all. And then also on your liability waiver, you may want to include things like photo capture, as well as making sure that people understand that there is an inherent risk in social gatherings. Then another thing to do is, as you're choosing your partners, think about how is it going to affect your staff. You're probably short-staffed right now. So how are you going to get the partners in line that don't make your life easier rather than harder? And Volin, with their geofencing technology, was definitely one of those that made our life easier. But make sure you also have backup plans for charging those devices, because not everybody will remember after 3 cocktails to plug in their unit overnight. So you may need to do some augmented charging stations in your meeting space, or just have additional devices available for your attendees. One, as Owen mentioned, as people come into the event space, you have to think of your event space kind of as a funnel. If you're going to do temperature checking or rapid test taking, you've got to define the path in before they have interaction with other attendees. So we had temperature takers that would check people's temperature, take a dot. If you passed, you got a dot on your badge for that day. If you didn't pass, that meant your temperature was not within the threshold that was preset. We asked the person to go over to a private area, which we had designated in advance, to sit down, cool off, take your temperature again. So you've got to set those policies and what your threshold is going to be before you have the people come through and go to the registration area. And then you need to also consider, what's your policy going to be for inside versus outside? And what about cocktail parties? And who's going to be policing people for these? Are you going to have a compliance officer? Are you going to have all staff be the mask police? Or are you going to hire a separate security company or team to be the mask police? And these are all budgetary considerations as you're working on your budgets for the events. The other thing you need to figure out is, are you going to share photos, and are you going to have somebody police the photos to make sure that those that are being shared are compliant to your policies? Because social media is a thing to be aware of, and you may want to, even in your announcements to the attendees, say, hey, we're not looking to share anything that's negative to the group. We want to keep the meeting strong. So consider your social policy and how you're going to have photos shared. So what happens if somebody does come down with COVID or even another illness at your event, or even after your event? Where do they go? Do you have a secure area, or do they go back to their hotel room? What's the hotel's policy on allowing your guests to stay in the hotel? We had one event in October where the policy was, no, you're out of here, you're going to the hospital. And then the next hotel, it was, nope, you can stay in your room and we'll have things delivered to your door. And you can stay for up to 10 days. So know in advance what the hotel policy or the venue's policy is going to be with regards to ill guests. And it goes well beyond COVID. It's just a good safety tip measure for your event planning toolbox. And if you have geo-tracking, that's also a wonderful tool to help you craft if you're going to have tiered messages. One message to those that were in closer contact to the individual, and then another message to the full audience, or just to those that were in close contact. And also you may want to, if you aren't already collecting it, emergency contact information for your attendees. So if somebody does report ill and goes immediately to the hospital, you have the ability to ask them if they would like you to contact their emergency contact. Enough with the word contact. Then the ultimate part is to make sure you communicate your message back out to your attendees and your staff. You can definitely have a pre-staff meeting. Use the general session room for general announcements. Your pre-event communication is also key. Using an app for push notifications and reminders. And if you do a daily screening on an app or at the temperature check station, have them reference your policy as well. Well, back to you.
Hey, thank you very much. This, I don't know about you all in the audience, but this is a lot of information to take in. My understanding is there's going to be some information available on the chapter site, along with websites to go to, as well as I think no cost web link that sort of Angela mentioned about meeting planners being able to use, for their meetings and events. I'm going to get into some questions now, and the first one is going to be for Shannon. Because there seems to be a little confusion regarding privacy and how information is given to people or sent to people who may come in contact, and you have to notify them if on the contact tracing. And is this done through the app from the organization? Is it done from your app? Is it sent out to their mobile devices? What information needs to be captured in order to communicate with the attendees and those who have been in contact with folks?
Thank you, Walt. I just want to be really clear. Volon technology and other contact tracing technologies do not have access to the contact information for the attendees. So all communication would go through the meeting planner or the specified person that has access to the data. Also, Volon technology does not have access to be able to pull the contact trace and communicate to those individuals. We work very closely with the meeting planner to assist them to pull those reports, and then they know the pairings of the device ID with the individual. Privacy is really important when you're dealing with positioning technology.
So what you're saying is, if I understand, each person who's given a device, that device is paired with a number, and that number is then given to Angela, who has the master sheet, if you will. And then if something occurs, then it is up to the organization to contact the folks and tell them what level of exposure they've received. Is that correct? Okay,
correct.
Great. Thank you very much. Angela, I do have a question for you. What is, for example, when you've done your meetings already, what was your predetermined policy in regards to people who might come to the meeting and who were not compliant with all of your suggestions? Because you did a wonderful job educating people all along the way in all of your materials that here's what they needed to do. What happened if somebody showed up? What was your policy regarding that?
Well, first was the proof of negative test. And so some people didn't get their test results back or forgot to get their test. So we sent them down to the local CVS to go get a test. and come back. And we were, for those that hadn't submitted their results, we were proactive in reminding them that they need to do this. So a couple of emails were sent for those that hadn't done it in a day in advance. Then on site, where there was the check-in with temperature checks, nobody had an issue with that. We had them, as soon as they cleared the temperature check area, then they went through the registration, go get your tracker from Volon. And we had some people that were reluctant to wear the contact tracing until we explained it to them again. So, and then the mask wearing, that's the hardest part, is people don't want to wear masks all the time, especially with our events. There's a lot of one-on-one discussions that may take an hour, be an hour in length from start to finish, 4 or 5 different conversations during that time. That's a lot of talking with a mask on. So we had our staff going around policing the area, reminding people to please wear their mask. If they needed to take their mask off, they could go outside and have their conversation at a distance there if they really felt they needed to do that. But mostly everyone was compliant.
Okay. One of the things that we've also found out is that, and I don't know whether you spoke to this or not, Angela, but we also recommend that if you're going to require testing and you're going to require proof of a negative test, that you also have a supply of antigen tests or the rapid test on site as sort of a backup, because that's really important. We're dealing with an organization right now that, even though most of the people will have been vaccinated, they're still going to give the rapid test on site, just to make sure that all of their attendees feel comfortable about attending. Everybody is going to be different, and I think everybody in the audience and everybody on this panel will agree that the threshold for acceptance is different from everyone. But we as meeting planners need to be prepared for, as we always do, for the worst case scenario. Would you agree with that, Angela?
Yeah, and North Star, as an industry leader, wants to err on the side of caution and get our protocols out front into everybody's hands. I mean, I'll share our protocols. I think there again will be a link at the end. If anybody needs that, they can also reach out to me directly at acox@ntmllc.com. acox@ntmllc.com. But for right now, we're going to follow our rules, and as restrictions loosen, people are going to change, and it's region by region as well. We have a survey called the Pulse Survey, and in March, 75% of planners were going to require mask wearing. Our last survey closed last week, and that percentage is down to 58% requiring masks. And currently, only 27% require proof of vaccination or a negative COVID test. So the rules are going to be changing week by week for planners. So just stay abreast of what's happening in the industry. Talk to your venues about what they've seen as successful, and use the partners they found in the local area for you if you don't have partners that are here on the screen already.
Yeah, thanks. I do have a question for Owen before we get into, as Shannon and you alluded to, and there's been some questions about that, about the current state of affairs. But Owen, are all PCR tests compliant? And so can people really go anywhere? That's the first question. And the second one, we talk about no cost. What does that really mean in terms of U.S. citizens going to meetings?
I think there's clearly 2 parts to your question. If the tests are EUA approved, as I had alluded to earlier, the efficacy of the test when the specimen is administered correctly, because there's always room for a little human error, are all about the same. The ability to process them and make sure it fits in your workflow is really what differentiates. And to what Angela was addressing as well, a call to action really helps people understand the value they get from the testing. An example would be another organization we had for a conference. I think they had 1,120 register. Of the 1,120 that registered, less than 10 did not have some kind of result when they presented at the conference. So how you present it to the attendees really matters a lot. To just echo what Angela said. Secondly, I think we need to divide no out of pocket to the testing subject away from necessarily some cost or potential cost to the conference. Kind of depends on how you set it up. I think you can have, particularly for smaller, more intimate conferences and events, it's a little easier to address that. There's technology opportunities, though, that apps access things that come from that secure online enrollment that can address some of the things that both Shannon and Angela alluded to in their presentations. Most of the time, it's either close to or no out of pocket for the attendees, because companies like ours will bill insurance companies that today are covering it in its entirety with no out of pocket, and those that don't have insurance are eligible for that to be forwarded to and covered by parts of the CARES Act or other authorized monies coming from the federal government right now.
Well, yeah, that's a key element for people to really understand that there really is little or no out-of-pocket costs. I know a question is going to come up regarding the antigen tests for on-site, and a rule of thumb right now is they're going to cost somewhere in the neighborhood of $25 a unit for the rapid tests. So that's just, again, that's just the pure cost of the rapid test. For a medical professional to administer the cost, it's an additional cost, but most of the companies that are doing the rapid tests are applying for authorization to have those tests to be self-administered, right, and have those results to be accepted.
Yes.
Now, I want to get
Yes, sir.
into. Yeah, go ahead, Owen.
I was just going to say, and as you look at that as meeting planners, the states regulate the CLIA or the CLIA waiver licenses. We know that when we are working with an event, that in that state we have to have a licensed oversight from a chief medical officer and an in-state lab access or licensed in that state, and we take care of all of that where appropriate.
Thank you. Now, because as everyone has said, these rules are changing very, very quickly. And announcement, came yesterday from the CDC about mask wearing if you've been vaccinated. And so I'm just going to throw this out to the panel to have anybody sort of answer it. What now that the CDC has changed the regulations of emphasize of people being vaccinated or not vaccinated as to wearing a mask or not wearing a mask? Do you create, for example, vaccinated areas in your meeting space? Do you create them in the reception areas or at the dinners? And is creating these areas sort of a violation of their privacy? We're all so new to this that at some point there's going to be some legal challenges to this. But I just like to know from the panel here what their thoughts are regarding this. I'm going to throw it out to Angela first to get her ideas.
Yeah, I think everybody's policy is going to change from one week to another. But if you aren't going to require social distancing, I would suggest maybe setting up different areas for proximity. A while ago, people were considering wearing yellow bands for I'm okay to be elbow bumped, and red stay away, and green I'm good to go. whether you're vaccinated or not is a private matter that is not, you can't put it on the badge. Somebody had suggested, I want you guys to put vaccinated on my badge so people know that I'm safe to be approached, but we can't. Could people select a ribbon that says I've been vaccinated? You could do that, but who's going to police whether or not they are able to wear that ribbon? So again, that, it's going to get into legal battles. And right now, North Star, we're trying to go out there and set standards so that everybody can see how it can be done. But it's up to individual organizations what they want to do. And I think, like I said, meeting spaces will have multiple tiers of seating pretty soon.
Okay. Anybody else want to comment on this area?
Yeah, well, I will. I do think, and I did mention this when I was talking earlier, whether you're vaccinated or not doesn't mean that you can't catch COVID or that you can't catch a variant. So I think that the need to be able to have safety precautions will still exist, and it will depend on each company that's holding the meeting and each planner about how much risk they want to assume as they're putting meetings on. But there's a lot of tools out in the market, and this conversation just shows we're just a portion of the tools that are out there that you can make meetings safe. Again, it's setting up those expectations before attendees come to the meeting as to what this meeting expects of you when it comes to the behavior at the meeting and the safety precautions in place.
And I want to stress again, a liability waiver is your organization's best friend.
Mm-hmm.
I would agree with that, and there are plenty of samples out there. But if anyone needs one, they can certainly contact any of us here on the panel. We'll be happy to share, that waiver. But it's, it's simple, but it's nothing ever protects any of us from being sued, but it sure really helps. Shannon, I do have a question for you. What are the range of costs in general for in-contact tracing? Is it per a unit? Is it per a meeting room? Is this typical throughout your industry?
Walt, it depends on how complicated your meeting is. If you're having a general session and maybe a few breakouts, the cost is based on the number of attendees and the number of geofenced areas that we need to provide equipment for. So it can be as low as $10 per person per day. But it can also, if you have exhibit space, it could be as high as $17 or $20 per person per day. We do sanitize and reuse the equipment in order to keep the ongoing costs low for meeting planners. So we work really hard to regain all of the equipment that we put out. But it really depends on the specific meeting, and we'll go through and we work with the planner to place it. Now, we are an analytics company. We're not just a COVID tracing company. So as COVID tracing maybe eases, analytics can be a lot less expensive, because if you're doing continuing education and you just need to know who's in the room or who's not in the room, that could be one geofence space for one meeting room. And that saves the meeting planner time, not having to count heads and to see which breakout room is the most popular speaker, or to know that someone was there for their continuing education class. So our goal is to bring efficiency in addition to safety with COVID tracing.
That's great. Thank you. And what happens if the person wears the tracking device outside of the geofenced area? Does it recalculate if they've come in contact with somebody outside that area?
Well, we can't control who you sit by on the plane or who you take your Uber with, but within the organized meeting area, that is where we capture risk. And we're not following you around 24 hours a day and knowing who you're spending your time with late at night or when you went to the bathroom. But your time within the meeting space, it connects to the geofence when you walk into the space, and when you leave the geofenced areas, then it disconnects for your privacy.
Wow. This is, like I said, I'm really blown away. I think what we're going to do is provide, Angela, if you can provide one of your sample of the waivers, we can put that in the slide deck afterwards, and I'll provide one of mine. I'll provide in the slide deck everyone's contact information. But I really want to thank the panel and everyone here for an unbelievable presentation. And I guess I'm going to turn it back to Donna to do some closing words.
And panelists for giving us invaluable insights on how to meet safely. We appreciate each of you joining us today. Please watch your email for upcoming special events and meeting in person this fall. Have a great summer.